Hello everyone and welcome back to the Santa Barbara Nutrients YouTube channel. Today we have a guest who I'm sure most of you watching this video have heard of before. Her name is Jess Saville and she's an expert renal dietitian. And today Jess will be talking about how to understand your lab values if you have kidney disease. Jess is a member of the National Kidney Foundation, and she was recognized as a renal dietitian by the National Kidney Foundation in 2020, which is a huge accomplishment. Jess is also a member of the Academy of Nutrition and Dietetics Renal Practice Group, a vegetarian practice group, and functional and integrative practice group. Now, what I find very interesting about Jess is her passion for helping to lift people out of fear of kidney disease and really giving them a path toward kidney health with the power of nutrition. And so Jess has worked in dialysis for almost 10 years before really immersing herself in helping people before dialysis. Jess strives to meet patients with kidney disease where they are in order to make impactful recommendations and lifestyle changes. And that really doesn't even begin to explain the experience that Jess has with kidney disease. Jess is the founder of an integrative private practice group called the Kidney Nutrition Institute, which focuses on pioneering integrative health and nutrition approaches for kidney disease. And Jess also runs courses for dietitians to teach them in-depth nutrition therapy for kidney disease, develops resources for renal dietitian, and then also directs the nonprofit RenAlign. Jess is also part of the program development team for the Renew program, which is a plant-focused, low-oxalate nutrition program for people with PKD. And this was developed by PKD researchers and renal nutrition experts. And one of the most impactful facts that Jess really touches on is that if you have kidney disease, it is not a lone journey. And Jess believes working hand in hand with patients through questions and concerns, meal plannings, and clear information towards kidney health is really the success for an individual that leads them to that motivation and overall approach to nutrition with kidney disease. And so if you are a patient and you're interested in working with a nutrition renal expert, meeting with Jess or any of her dietitians at the Kidney Nutrition Institute, we will post the link below this video. Jess is very, very experienced, with nutrition, kidney disease, renal issues, nutrition approaches. So we're very, very lucky to have Jess on our YouTube channel today. So without further ado, we will go ahead and speak with Jess, who's going to talk about how to understand your lab values with kidney disease. So Jess is here today to talk about a really important question that a lot of individuals with kidney disease have, and that is about how do you understand your lab values. So we do have our expert on board here today to discuss some of those. Welcome again, Jess. It's great to have you here.
Cool. Thank you for letting me be here. I'm excited to talk about this super important topic. Tons of questions about it. It's a really powerful tool for each individual to utilize, so if we can clarify a few things.
Great. So perfect. I guess what we'll just start off with, Jess, so are there any labs that individuals, let's start particularly with polycystic kidney disease, and maybe it's the same for chronic kidney disease, that individuals should really pay attention to when they're going and getting labs done?
So when you go get labs, your doctor puts in an order, and generally they do like a basic metabolic panel, and it comes with things that they're looking at like GFR and creatinine. They're looking at metabolic acidosis with CO2, potassium, phosphorus. Those are some of the ones that show up there. There's a lot of other labs that come with that. These are some that we hone in on a nutrition standpoint. We look at, when we get them, vitamin D levels, anemia lab panels are really important. So there's a lot of labs that play into it, but typically, almost every single time people get labs, they're going to have GFR, creatinine, potassium, phosphorus, albumin, which is fairly irrelevant, and the CO2 levels are some of the ones that we like hone in on immediately on a regular basis.
Okay, great. And so it sounds like typically when individuals are getting labs done, maybe they were directed by their dietitian or their nephrologist. So a lot of times there's not much explanation, what that actually means. And I know you kind of pointed out a few of those that you as a dietitian really look into as well. So maybe we can go through those that you just pinpointed. So for instance, I know obviously the glomerular filtration rate or the GFR is something that individuals with CKD or PKD are always really looking at. So what is the purpose of that lab?
That's a good question. So in kidney disease, and PKD is just a tiny bit different when it comes to this, but I'll give the overarching principle. So when GFR and creatinine and also proteinuria, protein in your urine, are three of the big markers that physicians use to kind of rate how fast people are progressing. Now, it's not exactly like that for polycystic kidney disease, because those can stay stable for a long time and then suddenly drop. So they're using more total kidney volume, a couple other like outside markers, but they're still great things to look at. It's where most people hang their hat, the glomerular filtration rate in particular, because that tells you not exactly, but about the percentage of your kidney function. So, and it's where a lot of people start, making decisions. So if your GFR is less than 15, or if it's, less than 20, but going down really fast, the doctor will be talking with you about transplant and does that need to be in your future? It's just a really important marker, versus people also use it as a marker of I've improved, my kidneys are getting healthier, they're getting stronger. And so that's how they're using glomerular filtration rate. GFR actually is quite controversial in the kidney space. It comes from not like a one blood measure. It's a lot of different markers in a long formula that is plugged in. It's been researched to death, and there's a whole bunch of different formulas that you use. The most important thing when it comes to GFR is that people watch trends. One data point from like a week to a week, it can fluctuate based on your hydration, if you just exercised hard, a bunch of other things. So the most important thing is that you watch a trend and you don't hang your hat on one number, but it's always on what it's doing, either going up or going down, because it's a pretty inexact measure.
I like how you mentioned that. It's kind of, it fluctuates a little bit, it sounds like. And that could be dependent on maybe dietary changes. It could be dependent on fluid intake. And so how, I guess based on that and knowing that there are fluctuations, is there a specific, frequency in which these labs should be done to say, okay, actually now your GFR seems to actually be at, 25 as opposed to 35. What's that really look like from a practitioner side?
Yeah, that's a really good question. So in a regular follow-up, if you're going to see the doctor every 3 months, every 6 months, every 12 months, usually you'll do your labs with what they feel like is a regular interval to follow you at. So people with a lot higher GFRs, they sometimes don't see the doctor except maybe once a year, just as a follow-up, unless they've done some of the ratings and they look like they're going to progress really fast. Then they might see more frequently. But usually, every year, if your GFR is really high, if it's starting to get lower, the frequency of your visits generally increases so that they can monitor not just GFR, they're monitoring all the labs, because the less kidney function you have, the more imbalances and abnormalities you have. The one exception to that is that when you make any significant changes, so let's say that you're going to start a new medication, you're going to start a new dietary therapy, like ketosis, ketogenic diets. In that case, it's really good to take a baseline measure, so get your labs done before you start the intervention, and then get the labs done about 90 days after you've started the intervention and if you've been consistent with it, because then you can start seeing where some things have shifted and changed. For us, if people have a potassium risk, we might have them get labs 2 weeks after we start a dietary change, just to make sure like it's not super high or whatever. So it just really depends. But the measurement is, what change am I making? Is it going to impact some of these markers that I need to be watching closely for safety? If so, you get it drawn more often, but your doctor, your dietitian can guide you when. And then if not, then for your own sake, it's good to have that marker know how successful was this for me? Is this really making a difference for me? And so you do it, usually 90 days gives you a good time period to know if things are starting to shift.
Okay, 90 days. That sounds good to kind of give you, especially if you're doing a different, dietary approach, right? I feel like your body needs to have time to kind of adapt to that in order to actually show some change in the labs. That's great. I'm glad you kind of explained that because, personally, for instance, if I was to go get a lab drawn and I'm like, oh, whoa, this is way off. And 2 weeks later, you have to give yourself that time. And like Jess mentioned, the dietitian or, any type of practitioner that's overseeing you for these labs can really determine which frequency is best for you. So we're talking still about the glomerular filtration rate. I know that there are several different ranges. Could you kind of discuss those and what they mean?
So when it comes to GFR, I'm going to share this heat map. This is, commonly used by a lot of the professionals. What you'll see here are the different stages of GFR. And we have stage 1, greater than 90, stage 2, 60 to 89, 3A, 45 to 59, 3B, 30 to 44, stage 4, and stage 5. And typically at stage 5 is where you start thinking about dialysis. That's not 100%. I've had a lot of people with very low GFRs, 6, 8, 10. They're not on dialysis and they do fine. Even with PKD, and we use some pretty aggressive dietary interventions to reduce the uremia. But the other piece that really plays into progression of the disease, and again, this is for CKD, not PKD, so there are some differences there, is that you're looking at how much protein people are spilling. If you're spilling a lot of protein, it is quite predictive that you're going to progress a lot faster than someone who's not spilling a lot of protein. But this is how you kind of identify your stage. And for us as dietitians, for physicians, when we look at people's stage of kidney disease, it immediately starts triggering a thought process on what we need to specifically look at. So for example, at stage 1, 2, 3, 99% of the time, potassium is not even an issue. I'll glance at it, but it's just not generally an issue at all. I hope those people eat a lot of potassium because it'll help their blood pressure. But people stage 4 and 5, I always immediately on that page are going to look at potassium and see if this is something we have to be conscientious of because it's more of a risk at stage 4 and 5. So there's some things that are higher risk at lower stages that we really pin into. They might end up being a little bit of a higher priority than other things. And that's how I use the staging when we're making decisions on how aggressive we're going to be with the diet and, what's going to be the best intervention.
Right. So it sounds like it's a little bit, I really like that visual. Thank you for sharing that, Jess. It sounds a little bit like the interventions are determined on multiple lab values, right? And so it's not just, your GFR, your stage 3, it's what's your potassium, right? What's your calcium? And all of these things seem to have that. So it's more of a very personalized individual plan for somebody based on labs. I think that's important to note as well.
Yeah, and even for polycystic kidney disease, for us, when we're looking at proteins like so controversial when it comes to ketogenic diets and PKD, the research doesn't support, heavy protein restrictions for PKD, but you have to take into account those stages, right? Because if someone has PKD and their later stage, we would be doing harm to do a lot of protein in a ketogenic approach at that point. Versus someone whose GFR is like 70, 80, 90, I'm not quite as worried about them being really tight on the amount of protein if they're doing ketosis versus I just want them to make sure they're still alkaline, so they're heavy on plants, but I don't have to be quite as meticulous with the protein as I would with stage 5. So it really, like, knowing your stage definitely drives into the therapy that you're going to do.
So the next common lab, I know you mentioned earlier on too, was the serum creatinine. Could you talk a little bit about what that actually is and then what normal ranges usually are for people?
So creatinine is a waste product from energy produced in your muscles. And it filters through the kidneys. And so when your kidneys aren't working very well, the creatinine can go up because it's not filtering as much. It's one of the little metrics in the GFR as well, which is why when creatinine goes up, GFR goes down. So that's another big place that people hang their hat. If my creatinine is going down, it's getting closer to normal, then it means my kidneys are functioning better. So that's why it is watched. It can be a good measure for some people, and it's definitely one that you're going to want to watch the trend on, just like everything else. If you have had a really heavy workout the day before, it often will be a lot higher than it typically would be. So we have a lot of people in the PKD community that just like, they love to work out. That's their thing. And one thing that we recommend is for consistency on your labs, don't do like a super heavy HIIT workout or like a 100-mile bike ride the day before your labs, because it'll make your labs look really bad.
Right.
And it just gets into your head, right? Like, oh, my kidneys are failing, things are bad. But it's just that you have a lot of waste products from your muscles breaking down from that exercise activity during that time. So just give it a couple days, have a light exercise day the day before your labs, hydrate really well so you get really consistent markers on where you're truly at over time.
Is that, you mentioned exercise. Is there anything else that might, have that lab value fluctuate a little bit more than normal?
If you have tons and tons of protein, if you're eating like a super heavy protein diet, then yeah, that's going to definitely impact that lab as well and make it look a lot worse. Your body has to filter all that out. So that's the other big one where we see people, they switch to ketogenic diet, but they're doing maybe it's not really a true keto because it's so protein heavy. It's just low carb, high protein. And they'll be like, oh, my labs got really bad. And yeah, it did because you ate a ton of protein that had to get processed. So.
Right. Okay. Perfect. And then is there a normal range in which, I guess somebody, if they're looking at their lab values, I know typically lab values will obviously come with, it's high or it's low or you're in range, but
yeah,
I didn't know if that was something that.
So GFR is really specific on numbers. Creatinine, what we do as clinicians is I look at the lab sheet and I say, hey, here's the normal range based on your lab, because every lab has a slightly different normal range. Mm-hmm. And then that is what I will trend and track over time. So I'd use it comparative to whatever the lab sheet says is normal. But the most important thing, I'll probably say it like 100 times during this episode, is doing your own tracking and trending. Because if you know where the trends are on your labs, then you can really hone in on them.
All right. And now let's get into maybe some of the blood electrolyte levels. I know that you mentioned particularly as a clinician, you're looking at calcium and phosphorus. Are there other lab values or blood electrolyte values, that you're usually looking at? And if so, why?
So the ones that get the most attention in the kidney world as a whole, these are like the stars of everything, and they drive so many food decisions, which is unfortunate because they're not even the most impactful ones. But for sure, potassium, an electrolyte. Everything you read online is like, if you have kidney disease, top 10 foods to eat. Okay, well, don't eat bananas, potatoes, whatever, because they have potassium. People are like, whoa, like potassium hurts my kidneys. Not true. Potassium doesn't hurt your kidneys. It can get imbalanced because your kidneys help balance it, but that's generally, like I said before, at later stages. So if you're at an earlier stage of kidney disease, it's good to just keep a tab on it, but you don't necessarily have to restrict your dietary potassium. It can fluctuate up and down quite a bit for a lot of different reasons. So we look at it as clinicians, like I mentioned, for later stages in particular, or if some people have started certain types of blood pressure medications, and we'll keep tabs on that. We definitely don't want someone to go super high and end up in the hospital, but it's probably not as big of a concern as the amount of attention it gets. But it's one that I would put on a trending sheet and just always make sure that I'm conscientious of it. Phosphorus. So phosphorus is the other one that gets a ton of attention. The research on phosphorus is really interesting in kidney disease. So you will not see your phosphorus levels really change until later stages. Our body is really good at compensating with a ton of different mechanisms to keep that blood level stable. Here's where trending is really important. It will look, you start having bone metabolism imbalances as early as stage 2 or 3. It will never show up on your labs. Like, it's one of the big nephrology problems to solve right now, is how are we going to really target when bone problems are happening, and there's a lot of labs that go into that. But for you as a patient, the most important thing is that if you have your phosphorus levels on there and your calcium levels on there, you just watch for the trends, because over 1-2 years, if you slowly start seeing your phosphorus going up, 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 and up, that is something for you to be aware of and bring to the table with your clinician, your dietitian, your doctor, and say, hey, like, I've noticed this trend. What can we do to intervene with it? And there's a lot of things you just proactively do in your diet. Like, don't eat processed food that has phosphates added to it, chemical phosphates. I mean, we should all do that, whether or not we have kidney disease, avoid those.
Right.
And other than that, then you're just going to keep it on your physician's radar. They're going to just look on your sheet, and most doctors, when they get your labs, they're coming in to see you, they're going to read through it really quick. They'll see where it's red or it has the H next to it for high, and they're going to circle those and make sure that they talk with you about them. If it doesn't have a number next to it and it looks normal, they don't always know, other than like 2 or 3 labs back, if it has been trending up. And so you as a patient can be really proactive and say, hey, I've noticed these trends. What do you think about them? And kind of go from there.
Okay, yeah, that's a great idea. I like that approach. Is there a time where maybe GFR is staying stable and potassium is just going through the roof? Like, or do they typically, do they synchronize with each other, or is there some times where it's just one's normal and the other is just completely off?
Well, I mean, the only associated trend there is that if you have less kidney function, it's harder for you to balance potassium. It's not so one plays off of the other so much. Just overall, if your kidney function is poor, you're not going to balance potassium. Potassium can be independent of, it can change independently of GFR. For example, if you're really acidotic, you've got, I know it's going to drive your GFR down, but if you have a lot of metabolic acidosis, your potassium is going to be higher. If you have blood sugar issues and your blood sugar is always through the roof, it drives potassium out of the cells. Your potassium is going to be higher. If you're constipated, you hyperabsorb it. If some blood pressure medications change that balance of the potassium and the sodium and the different electrolytes, and that's going to make it go higher too. Some of the recent research on potassium says it's far less associated with diet than we think, but that is always the default. It's high, and so we have to change the diet. And that's an okay band, right? That's an okay area just to make sure it doesn't go too high. And certainly, people could be drinking tons of coconut water or something and maybe drive it through the roof if it's hard for their kidneys to filter it. But usually if it's high, the right question to talk to your doctor about is, can you tell me a little bit on what are some of the things that are causing this to be high? And the wrong answer from your doctor is, it's because you have kidney disease. That's not the right answer. You want to understand, what is going on in my body that's causing this to be high? Is it, what are the contributing factors? That's what you want to dig into, because then you can kind of get a little bit of traction on it.
Right. Okay, perfect, great. So yeah, we covered kind of, I think, primarily the base, of what individuals with kidney disease, they get all these labs done. But the ones that we covered, I think, are primarily some of the most important ones. My other question to you, Jess, are there any other lab values that you as a practitioner look at that are typically a direct result of diet influences or can be modified or managed with diet approaches?
Yeah, for sure. The other big one, and I've already mentioned it a couple times, is the CO2 level and targeting metabolic acidosis. That one, for whatever reason, is not always proactively addressed. And the other thing that's tricky about it is a normal on a lab set. It'll say like normal CO2 level is 20 to 30. And so no one really doesn't seem to do anything until you start getting to like 20, 19, 18, 13, 14. I've seen people quite acidotic, and the doctor's like, oh, okay, we need to address this now. The research actually shows that your best preservation of kidney function, the best outcomes come with a CO2 level that's somewhere between 25 to 28. And what will happen to patients over time is that, they'll be like 25, 26, and they'll get their labs 6 months later, now it's like 24, and then 6 months later, now it's 22, 23, and it's definitely going down, but no one picks up on the trend, unless you're trending it, until it's like, has fallen down below 20, and then you're quite acidotic at that point, and it does cause, progression of kidney disease as a whole. It's so easy to intervene with. It's so easy to intervene with metabolic acidosis. You can do things like eat more fruits and vegetables, right? More fruits and vegetables is really, really powerful. So that's number one. Number two, some doctors will use sodium bicarbonate. That's kind of the go-to medical intervention. For me, if they don't have potassium issues, that would not be my first. That would not be my first intervention, but that's something that people do. Even in the case of Ketocitra, that is something that helps alkalinize as well, because it has some of those same minerals in it: magnesium, potassium, calcium, that help with metabolic acidosis. So as kind of one of the little side perks of Ketocitra. But that's another intervention, is use some of those minerals. Plants have a lot of minerals. You can get those levels up, and that helps resolve the metabolic acidosis. It's just really powerful. So more plants, it works every time.
But thank you again, Jess, for your time. Really appreciate this. I know this is a hot topic these days, so it's great to get your insight on it. Perfect. All right. Bye, Jess.